How to assist in a composite filling. First thing is placing the topical anesthetic. So she is drying the area. And with the cotton tip applicator, she's going to go straight to the ends of the roots of the tooth that we're going to work on the mucobuccal fold or the vestibule. So obviously the cotton tip applicator fell because the cheeks are not holding it, but obviously on a person it will stay in the area for a minute or until the doctor is going to numb. When the doctor gets there, he'll take out the cotton tip applicator and then numb. Over here, she is giving the doctor the shade guide because it is a composite, so we need to take the shade. So that's why we're doing it at this time. It could be after the injection, but she decided to give it to her at that moment. So now the doctor is going to numb, and you're going to see that she is getting prepared the cap with the cotton pliers. So when the doctor is done, she is going to recap it without using two hands. It's a single-handed scoop. But she's not using her hands. She used the cotton tip applicator for her hands to be away from the cap to recap that needle. Then the shade that she got the composite, and she put it in the composite gun. So now the doctor is going to come back, and then they're going to start the prep. So for the prep, first she is going to use the high speed. So for the high speed, you need to have your HVE in your right hand, and then because it is a maxillary tooth, she has her air water syringe just in case when the doctor is using indirect vision. She's going to blow air onto that mirror so the doctor can have better visibility. The assistant has the HVE with the bevel facing the tooth and more posterior, a little bit more posterior than the tooth that the doctor is working. Because of gravity, that water is going to go to the back, and so she can suction it. So now the doctor is using the low speed. However, if you can see, that was the burr that I got. It was just there on the low speed, so that's the one that I use. That it's a polishing burr, but it's supposed to be a round burr that I'm supposed to be using at this moment. But because I'm not using water, so you don't need to use the HVE at that moment. Now she got the spoon excavator. So you see that she has the gauze in hand because whatever it is that the doctor is removing, she is going to be cleaning it off from the instrument. So you need to have that there. So now the doctor asked for the Explorer just to check that there is no more cavities. Again, I guess she felt something soft. And now she's using again the spoon excavator. I guess she doesn't want to use the low speed because it might be too close to the nerve. So that's how you would be doing it. So now she is going to isolate. So she is going to get cotton rolls. So because it is the maxillary, so you would only use one cotton roll. Some doctors can use a triangle, but over here she just got the cotton roll. Because it is a class 2, the Tafelmeyer was supposed to be ready for the quadrant. So for that quadrant, because it is upper right, that Tafelmeyer was already ready for that side of the mouth. And then she passed it to the doctor, and now the doctor is placing it. In some instances, you as an assistant would need to place it. This is the wooden wedge, so you'll place it on the side that you are replacing the wall to create the neck. So the next thing is you're going to pass the edge. This is phosphoric acid, 37%, and this is to remove the smear layer or the dental dust. While I was doing that, you were seeing that she was preparing the bond. She was putting the bond in the well, getting the micro brush ready to pass it as soon as those 15 to 30 seconds that edge is going to be there. She was doing that in the meantime. So now we're rinsing that out. First, she placed the HVE to remove as much acid first, and then the doctor will put the water. Now she will pass the bond with the micro brush. Sometimes you will do a primer and then the bond. So it'll all depend. For this one, everything is together. So you could see the doctor thins it out, but then you need to cure it. For this one, you will cure it 10 seconds. Once that's done, she'll be passing the flowable. Once the flowable is there, you will pass the curing light. This one, you will cure it for 20 seconds. She has the next step that it's the composite ready. So she's passing the composite. Once the composite is placed, then you'll give the composite instrument. She has the curing light ready so she can receive the composite instrument and pass the gun. As you can see, all of the instruments, she is giving it with her left hand. And because these instruments are big, she is using the right hand to retrieve it from the doctor. So it is kind of like a dance. Now she's going to cure it, and you're going to see she gives the composite first. Composite. Then the doctor will need the instrument to give the anatomy to the tooth. Once it's there, I think she's asking for a burnisher now. And once they carve it, once they give the anatomy, then they cure it. So you need to know the steps on what comes next and be ready. You're always thinking one step ahead of the doctor. So now you are getting the cotton pliers so she could retrieve all of the things because she is done with the filling. Taking the Tafelmeyer, the wooden wedge, and now slowly she's going to take the matrix band with the whole cotton tip with the cotton pliers. She will give it to the assistant, and now she's going to check the bite. If we need to adjust it, the doctor will use the high speed. Sometimes they don't use it with water, so you don't need to use the HVE. Over here, the doctor is using finishing strips because it was a class 2. I want to make sure that there is no overhang, that everything is smooth. Now they're passing the floss, and everything looks good. If they need to polish, then they would polish. For this one, maybe you would put a little bit of water if needed or air. It would all depend what the doctor wants. Sometimes you could do a limited rinse there. She's checking the bite again. You always follow what the doctor needs, one step ahead.